Hello, everyone, and welcome to HCD's office hours for ESG and ESG-CV. My name is Marian Goldburn, and I will be your moderator for today's office hours. We're going to hold a few minutes for more of our colleagues to join us for today's session. In the meantime, I want to invite y'all to introduce yourself in the chat box with your name and region you represent. We will begin soon. Thank you. Okay, I think we are ready to get started. Again, welcome to this week's office hours for ESG and ESG-CV. My name is Marian Goldburn, and I am today's moderator. If you are just joining us, please go to the chat and introduce yourself with your name and the region you represent. As a reminder, this office hour session is being recorded for public record. Office hour recordings eventually will be available on the HCD ESG webpage under Technical Assistance and Training. If you don't see them posted yet, just know that HCD is working on getting them uploaded to the website. A copy of the slide deck and recording will also be emailed to you by your grant administrator. Next slide, please. So if you have questions, this is how you should ask. All questions must be submitted in the chat box. Please type your organization and question into the chat box. The team will read questions out loud at the end of the presentation and will provide answers if possible throughout the presentation. Because today's topic has a lot of content, any questions related to ESG written standards and best practices will be answered via email when we send out the Q&A transcript. All questions and answers entered in the chat will be recorded as part of the public record, and we will be emailing out a full transcript of the Q&A. Next slide, please. So today's agenda includes ESG updates and ESG-CV updates, ESG-CV Q&A, and we will also have a brown bag session on ESG written standards and best practices. Next slide, please. So along with our presenters today, we also have several HCD staff, including ESG representatives, ESG-CV grant administrators, and other consultants who are able to answer questions during the Q&A. And now I will hand it over to Connie for our ESG updates.
Thank you, Miriam. Good morning, everybody. You're going to see some of the same information in the slides that you've been seeing from me in the last couple of weeks, but I just want to make sure that everybody has a, kind of understands what we're doing and to make sure and see if there's any questions at the end of this presentation. Again, for those of you that submitted applications under the 2021 ESG annual NOFA, we're getting closer. We're getting closer to finishing those up. We anticipate announcing awards. It's going to be February, probably mid-February before I'm going to have that for you, but we are working as hard as we can. For those that have 2020 annual contracts with us, you probably have already received an email from your ESG grants rep if you have not submitted your first request for funds to us by now. Again, remember that per your Exhibit A, which is part of your executed contract with us, you are required to submit your first request for funds within 120 days of the execution of your contract. And we are past that now for everybody. So if you haven't sent in your first request for funds, we will be giving you a call. If you have some concerns, please reach out to your ESG grant rep, and we'd be happy to jump on a Teams meeting with you and talk through it. But that is one of the requirements. Also, you're required also under Exhibit A to submit at least one request for funds once a quarter. If you want to submit more than that, that's great, but at least once a quarter. We can't have any more where we're getting your first and only RFF at the very end of the contract. It's very important that we stay in compliance. Also, please don't hold on to your RFFs. There's some grantees who like to send us 6, 7, 10 at a time. That really gets to be kind of difficult. Sometimes math errors are made. So if you can, when you get your invoices, you prepare your RFF, send it off to your rep. If you feel like that's not going to work for you, then reach out to us. But it becomes quite difficult when we're trying to go through making sure all the balances and so forth are correct and review all the detailed expense reports for, multiple RFFs that come in at one time. Okay, next slide, please. We've talked about this before, but I just want to make sure, because this is new for all of us. We're calling it mini monitoring. It's an informal process. We're not going to send you a formal letter. We're not going to send you a letter about findings or concerns. That will be our yearly monitoring. The mini monitoring was implemented starting with your 2020 contracts last November. And every request for funds that you submit to your grant rep, they're going to pick 2 expense items off your detailed expense report and ask for some backup documents, and they'll be clear as far as what documents they want from you. For example, they may pick maybe some rental assistance, maybe a line of rental assistance you put on your detailed expense report for that RFF. So they may ask you for a copy of a signed lease between the landlord and the client. They may ask you for an intake form, or I believe it's also called a homeless certification, to make sure that person qualified either for homelessness prevention or for rapid rehousing. If you paid for some security deposit for your client, again, they might ask you for a copy of the lease, documentation just showing where in the lease it talked about the amount of security deposit and so forth. So again, this is just so we can all make sure we're all staying in compliance and that we're being, that everybody's expending the ESG funds in an appropriate manner. If there's maybe an issue that your rep finds while they're reviewing your backup documents, they will give you a call, they'll send an email. I encourage Teams meetings and let's talk through it. It's meant to be a training opportunity. It's not meant to be punitive at all. It's really a training opportunity for all of us. And again, this is going to be part of the workflow. This isn't something that we're just doing for a while. This will be part of the workflow, every RFF. Even if you have 3, so we have some grantees that have 2 and 3 contracts with us for 2020. That means every RFF under each of your contracts will be affected by this. Next slide, please. Oh, one more back. Thank you. Again, just wanted to make sure we have a great ESG team. We have a full team now. And I brought 2 new members on in January, the beginning of January. So these are their names. We did do some realignment with the grant, with the management, the territory. So you may not have the same rep you had for your 2019 contract. But again, if you're not sure, you could always write to the ESG NOFA inbox. And we are in there every day, every few hours, monitoring that inbox. And we will be sure that we respond to you. And again, just want to know we appreciate your partnership and we look forward to helping you in any way we can. Thank you.
Thanks so much, Connie. Now we have just a few ESG and ESG-CV updates and reminders. Next slide, please. Please remember that your requests for funds for December 2021 are due by January 30th, 2022. Next slide, please. These are the upcoming office hour topics. Today's topic will be on ESG written standards and best practices. On February 2nd, 2022, we will have a training on ESG-CV new provider orientation and this session will cover a brief overview of ESG-CV and include an open dialogue discussion to answer all your new provider questions. On February 9th, we will have a training on California's HCD ESG-CV monitoring. And on February 16th, we will have our training in Housing First Principles. Next slide, please. So this slide covers some COVID response resources. And so you can take a look at these when you get this information. Next slide, please. We also have some ESG resource links that we would like to share with you. And these include the regulations, the ESG-CV notices, and some general information, as well as TA resources on disease risk and homelessness, ESG-CV summary notices, and strategies to design and implement a successful ESG-CV program, just to name a few. Next slide, please. Okay, so do we have any questions on what has been presented thus far? So you can go ahead and put those questions in the chat, and we will answer them if we can today. So while you're doing that, next slide, please. If you have any further questions, this is how you can reach us. For annual ESG, please reach out to your ESG representative, or you can email esg@hcd.ca.gov. For ESG-CV, please reach out to your grant administrator. Next slide, please. Okay. So I will now turn it over to Chris Pitcher and Erica Snyder for our today's brown bag presentation on ESG written standards and best practices.
Thanks, Marion. Thank you all for joining us. This is really our third week of doing brown bags, but really our second week of getting deep into them. As a reminder, these sessions we have moved to the Zoom meeting, so you can unmute yourself, raise your hand if you have a question. We're going to do a short presentation, Erica and I, on written standards, and then we just want to open up conversation. Last week was a great conversation we had on leveraging and braiding, and honestly, we just want to have a really good conversation. So put stuff in the chat if you want to chat. Also, feel free to raise your hand, unmute yourself if you just want to talk to Erica and I. We'll probably take about 10 to 15 minutes to go through the materials, and then it's just, we'll talk about written standards as long as you want to talk today. So I'm going to hand it off first to my co-presenter, Erica Snyder. Erica, why don't you go ahead and get us going?
Great. Next slide, please. So we're talking about written standards. That is essentially HUD speak for policies and procedures. You might call it operations manual, kind of like fill in the blank for how do you make the decisions to operate your programs and your funding sources. It might align ideally with your continuums of care, but that's essentially what this is. And folks might not know or be aware that it's actually a requirement of annual ESG, which applies to ESG-CV, that both recipients, so the state of California, as well as the subrecipients, so whoever receives that, has documented their written standards. And you'll see here's the reg that actually outlines what HUD means by written standards, and that is your baseline. You are welcome and encouraged to add localized information. What are your own policies? What are things that are tailored to meet the needs of your communities and tailored based off of your programs? I'm not sure how many folks were able to join the Monday call that the Office of Block Grant Assistance had on ESG-CV monitoring. It will be posted online if you weren't able to be there. Highly recommend that you check that out because it was our first sneak peek into what the HUD field office is going to be looking for in monitoring. And they doubled down that they are going to be looking at policies and procedures and written standards. Because ESG-CV, while it has its roots in ESG, it is its own unique and discrete funding source, and therefore it needs to have its own policies and procedures, specifically that tie back to how are you using it to prevent, prepare, or respond to COVID-19. that needs to get called out within there. Now, we all know it's not a huge leap, like that the safest place for anyone to be during this pandemic is in their own home. So if they are currently unhoused, like there's that tie back for you. But there might be some more nuances as it relates to if you're operating street outreach or rapid rehousing or emergency shelter that you would want to call out. So those are things that you can keep in mind. Now, each CD is currently working and putting the final touches on their written standards. Chris I believe y'all are calling it something a little different than written standards. That's what that document will be though. It might be an operating manual. Once that's publicly facing, that is something that you are encouraged to use and adopt into your own programs if it's relevant. And then again, localize it based off of your information. And then I put into the PowerPoint, but I'll just throw it in the chat for those who like to have multiple tabs open like myself. This is a document that HUD-TA created at the beginning of the pandemic, so another life, about how do you take what's required within the written standards and tailor it to our COVID response. And so that can give you perhaps some ideas of what that could look like. Next slide, please. So this slide breaks all of the slide deck PowerPoint rules. I'm not going to read this to you. I just wanted one place for you all to see that these are, when we say written standards, these are the minimum elements that HUD is looking for. Here, I'm going to throw into here a citation to the reg, because we all love to spend a few hours every day looking at some regulations. So if you want to see where we took this information from, it's there, but you'll see there is some specificity and perhaps some nuance that might not pop out to you when you're thinking about policies and procedures. Next slide, please. So here is one example of a minimum requirement from the regs. And this has to do with policies and procedures for essentially your emergency shelters. How are you going to admit people? What are your policies around diversion? So helping to do that housing problem solving for folks who may not need that shelter bed, but have other options in the community and they're just due to stress, not able to do that problem solving themselves in that moment. What does that look like for your ESG? And as well as what does it look like for special populations? So those who might be experiencing domestic violence or other areas that we should think about. And this is essentially just documenting what your current process is. And you may already have that, and that's great. Make sure it's referencing to ESG-CV. But what are your policies and procedures if somebody is getting access to a hotel motel room? That could be through Project Room Key. That could just be because your community doesn't have a ton of shelter beds and you always operate a hotel motel voucher program. Those are things to think about. What does it look like to isolate somebody who's been exposed to COVID-19 in your shelter? There's been a lot of great resources coming out lately about isolation in place, because we recognize that with each iteration of this pandemic, things need to be slightly tweaked as we respond to it. Perhaps there's a place in here where you call out the ways that you are using personal protective equipment or PPE for your staff. I would say if you are taking advantage of any of the flexibilities or nuances within ESG-CV, which I hope you are, document what that looks like. HUD wants to make sure that you know how you're using it, and then they're going to be looking in the future to just confirm that what you put on paper is happening in practice. And I say HUD, but I also mean California HCD will be doing that too within their own monitoring. Next slide, please. I think I'm like officially becoming the braiding and leveraging funds person, but if we know there's a lot of money out there, there are a lot of different funding resources. And so one big thing, and this made HUD's top 10 list of what they're going to be monitoring for, is duplication of benefits. So if you are braiding funding sources and you have multiple funding sources helping to stand up your programs, which I'm sure is the case for most folks on this call, just make sure that you're demonstrating how you're making sure people aren't being over assisted. So for rapid rehousing, for instance, when it comes to actually verifying folks like income sources, because you're trying to help create that honest budget for housing, how are you determining what that gap is? And if you're going to apply ESG-CV or a different funding source, those are just things that need to be within there. I would also say for duplication of benefits, document, and save it. Save it in your file, because if it's just living in someone's head, that's not going to stand up for any future monitorings. Next slide, please. One nice thing about ESG-CV's written standards, there's nothing new to them. It's, like I said, it's based off of the ESG standards. So that is within here, that we're really looking to see that you are at the documenting at the project implementation level, your policies and procedures, And this needs to be within your subrecipients. I know we might have some pass-through entities on this call. You are technically the subrecipient, so you need to have the policies and procedures for ESG-CV. Perhaps you adopt the ones that are coming out from California HCD once they're available. And then you need to make sure that your subs, I guess, in terms of this language, have their own documentation as well. So just keep in mind, it's kind of a trickle-down effect, but we're trying to remain consistent without that. If you're funding any of the new eligibility activities, let's say landlord incentives, how are you operationalizing that? What does that look like? How are we also making sure that it's being applied fairly? So you're not picking and choosing the landlords in your communities who get it, but there's some consistency across the board. How do you determine that incentive dollar amount? These are all things that it's not a gotcha moment. It's just like, what was your thought process, putting into paper? And then of course, like these can be dusted off. Like our programs are consistent. Things are changing in our environment. Your written standards can be an iterative process and should be. So make sure that you're thinking about that as you go through there. And then just one thing that I like to harp on, because I like to make sure that the folks that we're serving don't have any undue burdens to get access to our services. They don't have to demonstrate that they've been impacted by COVID-19. That is not a part, it's documented in your written standards. That's the level of proof that HUD's looking for. You don't need to make somebody explain to you all the ways that the pandemic has impacted their life, and you document it there. If you're already in the narrative, you're thrown in your case file notes, that's one thing. But just keep in mind that it's going to be covered by your written standard, and that's going to meet the threshold test. And with that, our next one for folks who may or may not develop their own written standards. This is just a process. This is not at all required, but this is my attempt at saying, how do we actually make policies and procedures something more than just a very dry document that sits on someone's shared drive, or maybe we like pen and paper, it's sitting on their actual desk. But ways that you write that out and think about it in terms not just of your community, but also what are HUD system performance measures? How are we aligning with our continuums of care's performance measures or written standards? Because we're all in this together. It's not ideally not being set up as 18 individual programs serving the community. And if there's an opportunity in that space, because we've also, like I've said, we've been in this for a while, can we pull together stakeholders to have conversations about that? Maybe it's around your shelter intake policy. There are different pieces. What do we want to think about to make these programs impactful and meaningful? And remember to make it equitable. I'm not sure how many people were able to be on the coordinated entry presentation last week that really talked about equity there. It's awesome. Save it, keep it. I was taking furious notes through it myself, highly recommend it. But just know that if you are making policies and procedures for programs and there's not a single person involved in the conversation who's experienced homelessness, you are missing something and they're not inclusive. And more than likely, you might be making it harder for people than ever intended. So let's keep them in this conversation. And then if you want to, like we could do this old school with public funding, publish them, let people have some feedback for it, get that on. Maybe you don't have like the opportunity to pull in every stakeholder, but let people know like, hey, it's available for you to give us your information. Policies and procedures shouldn't be a secret. It's how we guide the work that we do. And then ultimately you could publish it on your actual website. Now, like I said, these are recommendations and things to think about. And I would say also think about this in a broader scheme of not just for ESG-CV, but how do we meaningfully operate our programs to meet the needs of the community? Next slide. All right, I'm going to throw it over to Chris and Liz Lemon.
Thanks, Erica. And when we saw the slide deck, I knew I was going to take this slide because I do love Liz Lemon. And we also want to give you this is kind of an intermission for this little presentation. So I'm just going to take a second to remind you, if you have questions, raise your hand, put them in the chat. We're going to get to that in a moment. We want to have a robust discussion. Also think about what you've done with written standards in your community that might be innovative or useful for other of your peers to hear in a few moments. That was hard to say. So I'm going to start with kind of setting us up for success. As Erica said, we expect written standards to be one of the things that we're going to be monitored by HUD, which means if HUD's going to monitor for it, HCD is going to monitor for it. So as we begin the monitoring process, we'll be looking at written standards. A lot of our written standards have been set in stone for a long time and we haven't changed them. Obviously with ESG-CV, we have to make a few adjustments because there are different eligibility requirements, different flexibilities. And it is good practice to regularly check your written standards and make sure that they meet the needs of the community, specifically around assessing who is the most vulnerable, who will get services in emergency shelter and rapid rehousing, how long those services last. Those are really important things that we want to modify from time to time. We don't have to keep those set in stone. So as we get ready to set you up for success here, we want to talk about written standards that also can be called policy procedures, program manuals. What else do you guys call them in the community? Do you have a different name than policies, procedures, written standards, or program manuals? If so, put it in the chat, because we're going to want to know what those things are called as we use this very common vernacular. HUD says written standards, but we often take that and say, well, that's a part of policy procedures. I think it's also good to note that a lot of the things that are in your written standards are also going to be in other places as well. You're going to be mentioning HMIS. HMIS may end up being a link just to your HMIS policy procedures. You'll be mentioning coordinated entry. You might have a specific coordinated entry policy that you have to mention. So it's not a one-stop shop. You might have pieces of your written standards that are in other places. We're also going to talk a little bit about activity eligibility. It's obviously important as we think through our written standards that as we develop our projects and programs, we're serving eligible clients and eligible services, eligible costs. So we'll talk about that as well. Next slide, please. Okay, still setting you up for success. There are a few things that are going to happen when monitoring begins. If issues arise, they're going to tie back to written standards. How do you do X? So you're either going to have sufficient policy procedures to not have that as a finding, or you're going to have to know that you weren't just following what you said. So either your policies weren't all the way developed, or they didn't just clarify everything that needed to be clarified, or it did and you did something different, which happens. I mean, that is something that I think when I heard Erica speaking in her first part, that's what I think. You know, okay, we're doing landlord incentives, we're out there doing them, we didn't write it down. How did we determine that we're doing 3 times? Who gets them, who doesn't? It doesn't have to be a 20-page document to kind of talk about your landlord incentives, but it does need to be written down somewhere and consistent as well. So again, either you're not going to have sufficient policy procedures or written standards, or you didn't follow them. So I want to make sure that you just document. I think that's really all this is about. Document and update, and make sure that if you were going to have any findings whatsoever, you can either fix the documentation or fix your process to make sure that you're adhering to your written standards as closely as possible. Next slide, please. Okay, so you got monitored. You have some findings. What can you do to make it right? Well, obviously, we've talked about those 2 different things that could happen. Either you don't have sufficient policies and procedures, sufficient written standards. If that happens, you're gonna have to update those policies and procedures. Again, this should be something that you do on the regular anyways. I recommend annually. ESG does not move super duper fast. I will say that during the beginning of the pandemic, when ESG-CV came out, you might have had to update stuff in real time much more often. I know that lots of us were modifying our coordinated entry policy procedures real time, turning them to FEMA designation or COVID risk. That is a-okay. HUD encourages you to look at your policies and procedures and your written standards on a regular basis and update those. So if you are found to be insufficient to having the policy procedures, you're gonna have to update those. Not a big deal. If you have great written standards, but you decided to do things differently, again, we can talk about landlord incentives here. Oh, we can do landlord incentives, let's do it. We didn't write down what it was, or maybe we did write down what it was, but we're not all doing it the same way, or we're not following the procedures that we put in place. That's a really great opportunity for you to train your programs, train the administrative entity staff, to train, maybe it's HMIS or coordinated entry staff, and providers, to just say, these are the policies, these are procedures, we need to follow these. We have a potential issue in our monitoring, so let's just tighten up our practice a little bit. I'm going to hand it back to Erica to finish up this section. Erica?
Great. And thank you all for staying with us, because I know it's not the most invigorating topic. So next slide, please. So we just pulled together a few different examples for folks to think about. And then it's sample language, and emphasis on the word sample. We're not saying adopt this, but it's more brainstorming, food for thought. What would that look like? And so we've already talked a little bit about preventing and responding to COVID-19, but think about what that looks like for each of your programs that you operate. So we threw in here rapid rehousing, street outreach. A few of you have some prevention funds, emergency shelter, or if you have money on like HMIS, just calling out how that's going to be used for ESG-CV. I think a big thing to think about is if folks are exposed to COVID-19 or actually have it and receive that diagnosis, regardless of which housing type that they're in, or project type, I should say, what's your response? So if they're in rapid rehousing and they have roommates or they're living with other individuals, is there a place within there that you work to make sure that they are moved into a location where they're not at risk of spreading the infection? So could they have access to a hotel motel room, which is an eligible expense? So keep that in mind. But think through like what would trigger like this action and what would trigger this and XYZ. Putting things in there if you're using money for PPE, like what you purchased, what that looks like, what that could be. Also, we know that at different stages of this pandemic, as new information comes out and evolves, that we are just making sure that we cite back to it. And perhaps it's citing back to the website, not just for the CDC, but California Public Health. I know they've specifically released some shelter guidance, so things that you can refer to throughout there, and just making sure that we're trying to keep everybody as safe as possible. Next slide, please. This is kind of an interesting one. So thinking through what does coordination look like across not just your emergency shelter providers, but other essential service providers and just in general homeless services within the broader community. HUD specifically calls out with mainstream providers because we're not just in a vacuum. How are we working more closely perhaps with workforce development? How are we working more closely with public health? Hopefully, most of us have developed new relationships and partnerships through this pandemic. I know it hasn't broken down all of the walls, but some of them. So what does that look like? And how can we actually share about those partnerships that are happening in that instance? So maybe you're sharing about the local public health department and they're providing free testing to your community or to folks, that there are points that a lot of places we're working with people to help them get access to vaccinations. And so maybe it's outlining that you're providing transportation there. Just things that you should think about as it relates to responding to COVID and using ESG-CV and keeping folks safe. The other thing that I could think about is like, are you coordinating too with support services for veteran families, SSVF, other groups, your continuum of care? Take a little space to write out what that looks like. What Chris said too doesn't have to be this very detailed paper. It doesn't have to be a dissertation, but just kind of outlining what that looks like. Next slide, please. I have already talked about duplication of benefits. I'm not going to hammer home too much on this, but things for you just to think about is what does that look like? And then if you've actually created any things internally, like maybe it's a checklist for your team or a form that you have like your case manager or housing navigator or housing specialist fill out. Maybe it's an intake, referencing that. And you can always include like a blank copy of that form as a reference point. So things that I'm sure you're already doing, we just need to document and operationalize in that particular place. So how are you assessing that needs of the applicant, the person, the participant coming in? I would say if you have, I know this isn't for everyone, but for the folks who might have homelessness prevention funds through HCD, or even if you get it from an entitlement jurisdiction, you're really going to want to document how you're avoiding duplication of benefits in partnership with the emergency rental assistance funds that have been coming out. So keep that in mind. I know that's an area that HUD is definitely turning some rocks over when they're doing monitoring in that particular way. And next slide, please. Okay, so when thinking about emergency shelter that gets funded, it's in your admission, your diversion, your referral process. Is there anything unique and different due to COVID? How did that get modified due to this? A lot of shelter beds, shelters had to reduce the number of beds that were available, had to put in some, dividers, things to create it more safe. We use Project Room Keys. So what did that look like? What is your protocol when folks are being admitted or entering the shelter beds and they may have COVID related symptoms or if they were exposed? Now know that it's not Testing is not a requirement for entry, nor should it be, but there are things that you could be doing in terms of screening to keep folks safe and recommendations of like how folks can continue to be safe. So what would that look like? Are they being immediately sent to a hotel room or perhaps a specific quarantine isolation room in the shelter? Think that through a little bit and document that. And then for you also just want to say, I would say within this, like if you have coordinated entry policies and procedures related to this, these should be, I was going to say in synergy, but that doesn't make any sense. Those should be really complementary to each other. Do you ever have moments when a word gets stuck in your head and you're like, if I don't say it, it will not leave? That's what just happened there. So keep sure that you're being consistent with that across the board and that you're really thinking through too. We talk a lot about if folks have actually are like exposed to COVID, but also if there are more vulnerable populations, there's that risk of folks who might have a higher likelihood of contracting it and having severe health illnesses. What sort of precautions are being taken to help ensure safety for those individuals as well? Next slide, please. And then thinking through your own prioritization policy, both for prevention and for rapid rehousing. So what does that look like? Again, have this be closely in lockstep with your coordinated entry. And folks have updated and changed it due to COVID. And that's fine. And that's great. Save it. And I would also say sometimes this has changed at several points throughout the year for that, just because of COVID. Try to save each iteration of that policy somewhere, because depending on when there's a client file that people are looking at, it could be a different policy than what you'll have in 2 years from now. So it's always good to keep like one thing saved up to a shared drive. Even if you hyperlink to something, just keep it as backup because links break and things change. And so keep that within there. And you might have to update these policies and procedures. Some people just put like a little like calendar alert with like 4 months from now, dust them off, update it. That doesn't hurt. So keep that within there. Think through too how you're prioritizing households and if you're changing the length of subsidy. So before there used to be, we didn't have as many resources. And so we had to be very strict in our prioritization. Right now, we know the pandemic has continued on. And with an equity lens, we recognize that it's taking longer for people of color in particular, but for individuals who are low income to find access to jobs longer term. So you might need to extend beyond 3 months of rental assistance to 9 months. And so how are you going to determine that? What does that look like? Perhaps you wanted to do for prevention or others, like a specific equity analysis and look to see like these are the areas that are most at risk of experiencing homelessness. These are going to be areas that we do some targeted prevention. Those are all great practices. Document them. Next slide. And then this is just a little chart that I had found because with all the funding sources, there's all these things happening in different ways. You can feel free to like take a clip art and throw this in your policies and procedures because it just clarifies the income at intake, at reevaluation, and the frequency. There's been some waivers in place. And so ESG-CV is slightly different from annual. And so this might be helpful to have. It might also be like a little helpful cheat sheet for your team to have when it comes to their own checklist for their files. Next slide, please. We're almost there. We are in the home stretch. So things to know, I softened the language. I said HCD may evaluate your written standards. They're going to evaluate your written standards. So please have them, or your policies or procedures, your operating manual. Again, make sure that it meets those regulations that were outlined in the ESG interim rule, which is what I cited earlier, and that any of the eligible activities, the things that you're doing are in alignment with the ESG-CV notice. And they're going to want to also make sure that your written standards doesn't impact the eligibility of ESG-CV funded programs. Like you heard me say, these are meant to be dynamic. We know things are shifting and changing, that programs are having to iterate on a dime. So just as you go through, maybe assign to somebody to update these to reflect that. And then you could also, we are already, almost a month into Q1 of the calendar year. That's maybe it's something on a quarterly basis you review, reflect, and adjust based off of that and performance factors. So with that, I will hand it back to you, Chris.
Thanks, Erica. And thank you all for sitting through that. So written standards, as Erica said, not the most exciting topic, but it is foundational to our ability to be able to provide ESG and ESG-CV services. So we want to leave space here for the last 20 minutes to talk openly about anything around written standards. So if you have questions, please either raise your hand or unmute yourself and just ask Erica or I, or put it in the chat. Happy to also read them if you'd prefer not to be heard. Also would love to just hear anything that's innovative, anything that is particularly vexing perhaps about your written standards that you want to talk through with your peers. There are 70 plus people on this phone that all have to have written standards. Either they're HCD folks that have to have written standards, or they're you as community providers that and COCs that have to have written standards as well. So anything you have there, would love to have that discussion going. One of the things that Erica, when you were going through your slides, it just always kind of jumps off the page to me around emergency shelter, prioritizing folks for emergency shelter, because we don't really think about prioritization when it comes to emergency shelters. Person shows up, we have a bed, admittance happens. I think we do have to be a little bit more cautious in these days. A lot of our shelters have decompressed. It is harder to get into shelter than it has been in the past. We do have a lot of different types of shelter. So we might have some congregate shelters that have, created some space. We also might have a room key or other project like that that's, hotel motels that we've never had before. And that does create a little bit more need to talk through what admittance looks for. But that's what the part I was thinking about the most, Erica, that I wanted to kind of talk with you. I really wanted to say the word diversion is in that. And a lot of our emergency shelters may or may not be as familiar with diversion or have a policy on how to divert folks. And I think that's an area where we could look potentially as something we could update. So any thoughts on diversion and written standards? Because I know it's something that it popped off the page to me today.
Yeah, I think for diversion, it's something that I feel like is starting to get traction and maybe got itself like slowed down a little bit in the pandemic, but that housing problem solving conversation at initial entry and working with folks, I think is so important, because I had said it there, like that crisis and the trauma of not having housing or a safe space to sleep tonight can really make it hard for that critical thought and to break things down. And having another person who could think through that with someone, the types of questions to ask are great. I think also just being aware of the different resources that are available in your community beyond a homelessness shelter. There might be places that are a better fit for that. There might be other options, connections with faith-based communities, et cetera. And so I think there are more trainings on that are out there in the world. If you're interested in learning more about homelessness diversion and what that looks like, that we definitely can plug in. Chris, I can't recall if that was one of your trainings that should be posted on the HC website soon, but there are things out there, but also happy to have a conversation here with folks. I think it's a big mind shift in saying that just because someone presents saying they're homeless, we don't have to assume that they have to stay homeless. How do we actually they don't have to go through the whole shelter process. They may actually have other relationships and things in the community that could resolve it.
If you have any questions or good policies you'd like to share on diversion around emergency shelter, please go ahead and put them in the chat, raise your hand, we'll unmute you or unmute yourself and just talk. I am going to kind of turn our attention, Erica, to the chat. There is a very specific California question, and that is the concept of sub-subs. So let's just do the power of or the authority line here. So we have HUD as the grantor, to HCD as the recipient of the ESG recipient, and then HCD passes it to administrative entity, which is the subcontractor, which should be the place where written standards exist. But we also have other providers underneath that, they're going to have written standards. So we want to make sure that when we have a community written standard, that our programmatic written standards work with that it's not in conflict. So for instance, let's just say we say that our rapid rehousing is 24 months, but our written standards say we won't do more than 3. That's obviously a conflict that needs to be resolved between the project and the administrative entity. But that's not the question. That was more of just a setup. The question from Kathleen was specifically, as a sub, will our written policies be reviewed and audited? And I think the answer is 100% yes. If you have your own, and it's not just taking the written standards of either HCD or the written standards of your administrative entity, if you have anything that's more specific, more restrictive, more nuanced, that could potentially be something that would be reviewed in a monitoring, not only from HCD, but potentially from HUD. That is possible. In our previous rounds of stimulus funding, we did have monitoring that went down to the service provider level. And in fact, in some communities I was working in, we found issues at many levels, and not only the administrative entity, maybe something at HCD level, maybe something at the administrative entity, and maybe something at the local service provider level as well. So though we can't guarantee it, I would 100% be prepared to have those policies ready for an audit. Erica, anything you would say there?
I think just a good rule of thumb is if you have a grant agreement or a contract for that funding source, you'll need policies and procedures that could get looked at, because they want to make sure the programs are, when they're actually being distributed into the community, the money is being spent, that it's being spent with the intention and the right, like the rules and regs of that funding source. So ideally, if you're a sub, that administrative entity should be looking at policies and procedures. That should be something they've tried to say to guide how that works for everything. And so for what Chris said, I would say, like, if you've gotten the money and you signed a contract, document how you're going to use the money.
Exactly. So keep those conversations coming. I don't see anyone with their hand raised or anyone that is unmuting themselves, so I'm gonna just keep on going. Dee Dee from Los Angeles, welcome to the program. I'm gonna answer your question as best I can, but note that LA is configured a little differently from other communities. So we have subs there. That is a third level. So in your question, you asked if we needed to go down. It's similar to Kathleen's question, and the answer is going to be yes, but because of the nuance between LOCTA, LASA, and the providers, definitely work with your HCD technical assistance folks, Nora and Tom, to how to operationalize that, how to make that work, so that this isn't something that you spend 25% of your time doing. We need to make sure that we have written standards that are solid and that work for each level you have below you. Erica, anything you'd add to that?
I would just think that if your subrecipient has subs, it's going to be on them to do a little bit of monitoring for those folks. So just to avoid multiple asks for the same entities, make sure your subrecipient knows that they should have a copy of those policies and procedures that would be available to you when you're reviewing. So it doesn't necessarily mean you have to have them on file, but someone needs to have them and you can have access to them.
Sounds like a good way to use Google Docs or SharePoint or something like that. So you have them when you need them, but you don't have to spend a lot of time tracking them down all the time. I'm not seeing any more comments. Oh, thanks, Dee Dee. We just got one. All right, so I am going to refer this question from Esteban, I think, back to you, Marion. This feels like a process question. So if we ever have questions as providers, as administrative entities, on whether an eligibility, whether a client eligibility or activity fits within shelter, fits within street outreach, fits within rapid rehousing, they need someone to reach out to. Do you want to discuss the structure for that?
Yes. So if there are questions, they can reach out to their grant administrator. And if they don't know who their assigned grant administrator is, we can drop a name in the chat, so someone they can reach out to, and we'll make sure that they get in touch with the assigned grant administrator.
And Marion, as a follow-up, Esteban says, new to the ESG team, that's why they ask, want to make sure they do it correctly. So Esteban, if you want to put what community you work in the chat as well, we have a lot of grant administrators listening right now. They might be able to reach out to you directly as well. So that would be useful. And it is San Bernardino County. Thank you very much, Esteban. Erica, any thoughts you have before I talk about a few other things on written standards and what we're talking about today?
No, I just saw that Deirdre had a question in the chat, but otherwise, thank you all for sticking on to the very end and listening to all of this. And just know that it's something that a lot of communities too. I would say if you don't have anything developed on this, just Google it. At that point, like so many communities have it and it's publicly facing. A lot of technical assistance providers have already written standards for folks. So it's a good starting point. Like you don't necessarily have to start from scratch if you don't have something CV specific. If you have something ESG specific, what I've recommended to communities is put your CV stuff as an addendum. That way, when the program sunsets, you could just peel it out of your policies and procedures. But those are all of my musings, Chris, so back to you.
Yeah, and I think that was an interesting thing you just said, Eric. Just peel it out. So when you look at HUD guidance, so let's just call it the ESG HMIS program manual. When you look at the ESG HMIS manual, it tells you all the stuff you have to do for ESG. And at the end, it talks specifically about what happens for ESG-CV. And that's so when ESG-CV sunsets, we can just delete that section. We don't have to have that anymore. So having compartmentalizing pieces of your policy is not a problem, and you can definitely edit those as you need. Dee Dee also asked, when will HCD's written standards be ready? Dee Dee, I feel like I'm operating here as HUD headquarters and going to say my favorite term from them, which is imminently. We had them written, they're going through the review process. We hope to get them out as soon as possible, but things take time. So we don't have them ready. We really hoping to have them ready for today, but it did not work. So we will have them around as soon as possible, and we'll let you know. We're not going to sneak them out. You will hear in an office hour. You'll hear in a brown bag all about them. We'll walk through them. So yes, understood, Deidre, that you're also getting monitored soon. So it'd be good to have those. Understood, and we'll do the best we can to do that. Okay. There's stuff happening in the chat that has nothing to do with us. We have Esteban's being reached out to not only by the annual ESG team, but also the grant administrators. So Esteban, you ask, you will receive guidance and help here on eligibility. So we talked a little bit about diversion. I think another one, Erica, that we're seeing a lot of folks activate, and it was mentioned by Aaron in the chat, is hazard pay. And one of the first things when hazard pay became flexibility in the ESG-CV notice was, did I have to have a policy in place already to be able to do hazard pay? And the answer was no, but you do have to have a policy in place. Any guidance you have on hazard pay? I think we covered that a little bit last week, Erica, but I think it's worth talking about again.
Sure. So just know that your hazard pay policy lives in your compensation policy. So if you're using an ESG-CV, just reference back to that in particular. You need to explain how it's being applied. So what are the positions, what's the actual dollar amount? Are you using a flat rate of like $2 an hour? If they're hourly, are you doing like a $200 a week stipend? And then the frequency, how long will that be happening? Is it time limited? And then just also document like why they're at that increased risk of being in a hazardous situation for COVID. And then I would say just to keep in mind that if you're applying hazard pay, it needs to be done equitably. So it's neutral to the funding source that your staff are receiving their pay out of. So let's say that they are funded out of continuum of care funds, and you also have ESG funds. Everybody is eligible for ESG-CV hazard pay. It doesn't matter where they get their money from. It's also eligible for client-facing staff. So a lot of people think initially like case managers, but also think custodial staff, cooks, other folks who are in there. Think a little broadly and document it. And once you have that, just also know that I would recommend having your grant administrator at HCD review it prior to invoicing for it. That way, if there's any questions or more nuances, because this is guided by Part 200 of the regs, not ESG-CV. So that's more of your financial management accounting world. It's a little different. Their brains are wired a little differently than ours. So make sure you're just cross-referencing those. But another thing I would throw in, it's not hazard pay, but just also keep in mind that ESG-CV can be used to cover overtime. And that again is documented in your policies and procedures. So if you already have staff who are working more hours, like over 40 hours, you can provide overtime pay as long as it's documented in your compensation policies. That's just something to keep in mind as we go through this time. Not that I am advocating for people to work more than 40 hours a week, but in the event it happens.
Thanks, Erica. So last call, we have about 5 minutes left. If anyone wants to say anything about the written standards, share with their peers or ask questions of your peers, please do. You can either raise your hand, unmute yourself, or put it in the chat. I only have about one more topic I'd like to discuss with Erica in front of y'all. But I think it's a good one because you mentioned it pretty early on in the conversation, Erica, which is duplication of benefits. That is a tough one. I know it's a very nuanced conversation. Where is that duplication occurring? At which level are we held accountable? Is it at the recipient level, the subrecipient level, the provider level, the client level? And it also feels like duplication benefit feels different for different types of components. So I'm just going to say it's very easy as a client to have two street outreach workers you're working with that would look like a duplication benefit. But HUD says that's not really a problem. We don't really, that's not what we're talking about. There's no money exchanging hands. There's no housing exchanging hands. For emergency shelter, it's hard to be enrolled in two emergency shelters at once because they're so hard. There's so limited capacity these days that it's hard to be in two at once. So not really, again, a huge thing that HUD would look at. But when you look at the other two components of homelessness prevention in particular and rapid rehousing as well, that's where things start to get a little bit more tricky. Money's exchanging hands. And we have to be very careful, specifically in homelessness prevention, that the back rent that we're paying, or maybe the forward rent, that's the way we set up our homeless prevention project, isn't being covered by ERAP. Or is it being covered by CSVG? Or is it being covered by CDBG or any other services? It's a little bit more work to kind of document and make sure that we've done our due diligence. And I'd say the same is for rapid rehousing. It is hard to be in two rapid rehousing programs at once, but as money's still exchanging hands between clients and landlords and what have you, you want to be careful there too. So just wondering if you had any other guidance or any other thoughts on duplication of benefits, because as you mentioned, this is an area that HUD is extremely focused on.
They are. And I think sometimes too, it can just be helpful to almost have like a pick list for your staff of questions to ask folks. Because too, when you're going through at the, we're talking mainly at the client level, I would also say duplication of benefits at the emergency shelter level is going to be, are you covering each of these expenses uniquely by funding source? That's going to be more at the subrecipient or the sub-subrecipient level. So making sure that like FEMA, room key, and ESG-CV aren't all covering the same thing. Or whatever other funding sources. When you're working with clients, though, too, I think it's helpful because folks aren't always going to remember, like recall right away, all those things. So was a faith-based community ever helping them covering their rent or going to be committing to providing it, a few months ahead? Do they have, where's money coming from? Do they have child support? Do they have alimony? What public benefits are they getting? Those are things that are helpful to think through, again, when creating that honest budget, or also when knowing, and I refer to honest budget, that's like a rapid rehousing term we could talk about another point. But just kind of thinking through those details and then documenting how you're essentially, what you need to know is like, what's the amount of resources available to a household? What's the total amount that they need to be stabilized, and the difference, and your program's covering the difference. Document what that looks like. If folks are really interested in duplication of benefits, I have like a whole nother presentation I've done on it because people talked about it. So Chris can tell me, Erica, we need to talk about DOB, which is not date of birth.
Yes, that's correct. DOB is not date of birth in this circumstance. It is duplication of benefits. All right, I put in the last call. Anyone want to raise their hand, speak, or ask a question or have a discussion point? If not, we're going to give you a few minutes of your day back. Not seeing any. One more minute. Okay. I think, Erica, folks were so in love with the topic of written standards that they're just feverishly thinking about how many written standard changes they have to make and no more questions. So I want to thank you for presenting again this week. I think that's 2 weeks in a row we've had you on Brown Bags. I think you get a break next week, but thank you for joining us. I want to thank the HCD folks, Connie, Malavi, and her folks for doing the opening, and Marion for being our facilitator, and all the fantastic great administrators, Aaron and Kim and everyone else who's working on the backside of all this technology that you don't see happening in the background. There's people there. So thank you for joining us. We're back at it next week. Again, we're going to keep the same format, office hours up front, and then this brown bag discussion on topics in the second half. So please look for that. Again, the PowerPoint presentation and the recording will be sent around as soon as it is ready. And we'll also be posting that to the HCD website once it has been through 508 compliance. Thank you for joining us, and we will see you next week.